Pursuing a career in medicine was based off of interactions with my dad. So my dad was a doctor, and being able to go to the hospital with him as a kid and seeing the relationships that he made with patients and coworkers was something that I too wanted to pursue and develop in my own life. I always liked science. I liked anatomy. So even from a very young age, I think I knew that I wanted to do something in medicine. Plastic surgery is an interesting beast because we have the privilege of interacting with other surgical subspecialties constantly. So whether we're being consulted or we're consulted to interact for the best possible outcome for a patient, you start to know everybody that you're working with, and people trust you. You develop trust with different people, and it's really positive to have that in a workspace. How I educate patients in terms of making sure that they understand what they're going through from a surgical perspective, preoperative and postoperative expectations, being honest with them in terms of what I'm thinking about when it comes to the treatment algorithm, what I'm offering, what we're talking about, the surgery that we're talking about, what that means to them. All of that's a part of the educational experience when they're in, their preoperative appointment. It's lovely to have a family that you love spending time with. So I spend a lot of time with my family. I also bike. I would say that as a cyclist, I would call myself an amateur cyclist, which I'm reminded every time I ride with people who are actually fit. But it's a lot of fun to be outside, and it's something that I do like doing. When you have a consultation with a patient for surgery, we tell them that you're initiating a relationship with us. It's very rarely a one and done scenario from a surgical perspective. And that's wonderful for us because we actually get continuity of care with patients. It's not that they just come through the door and then they're gone. We get to see them for months and months and make sure that they're recovering appropriately and that they're happy with what they have achieved from a surgical perspective. Being able to be happy and be enthusiastic and have a great attitude every time that you come to work, long term when you're seeing patients, that has huge ramifications long term. So I think altogether, it just provides for better patient care. When patients are seeing us in clinic or in the preoperative area especially, having a provider that is coming in professionally but informally, they're with a level of confidence that makes you feel like you're being taken care of and that they're going to do everything in their power to provide the best level of care for you. I think that immediately lowers the nerves preoperatively or even in a counseling or a consultation scenario. Also, just being available to answer questions, to spend that extra minute and talk about what we're here to do and how we're going to achieve that and how we're going to get you through it and what the expectations are postoperatively and long term. All of those things together, I think, make patients feel confident and relaxed and make things better long term.